When you think about heart disease, you might think about it as a mostly male health issue, but that's just not true. And it's not just an older population issue anymore either. Heart disease is the leading cause of death in the U.S., and coronary heart disease costs over $100 billion a year. And here to talk about what we can do to help prevent heart disease is Dr. Francisco Velázquez and Patty Sipes from PAML. Welcome.
Good morning.
Such an important topic. Yes. And Doctor, last time you were here, you spoke about empowering consumers when it comes to healthcare. Can you just remind our audience what you're doing?
Sure. In addition to the clinical testing, we have a full line of consumer-oriented products that allows consumers to monitor their health.
That is so important. And women are affected by heart disease more than we think. And the statistics are really alarming, Doctor.
They really are. If you think about it, it causes about 400,000 deaths a year on just women alone, particularly over the age of 40. That's about one person, one woman every minute.
That statistic is just staggering. I had no idea. And Patty, you have a history of heart disease. Tell us what happened to you.
Yes, I do have a history of heart disease. My grandfather had his first heart attack at age 28. His son had his first and only heart attack when he was 50. He had jaw pain, thought he had to go to the dentist, and he died the next day. So my son was also born with a heart ailment, although they say it wasn't genetic. So I take it very seriously. And when I was about 32, won't say how old I am right now, but when I was about 32, I did have a situation where I had some symptoms, and I've been in the medical field for quite a long time. I said, gee, my arm feels like someone's grabbing it really hard. My breathing's off, I do feel confused, and I did have some pain in my jaw. I thought, okay, do something. So I waited a little while to see if it went away, because I didn't want to waste anybody's time. I didn't want to go if they wouldn't tell me to do something. Oh, it's all in your head. So I waited, and then I didn't have a set primary care physician at that time, so I said, oh, I'll just go to one of the places you can go without an appointment. Went in, described everything. They did nothing, and they said, oh, you're fine. And I said, well, what do I do? There's something going on. And they said, you need a good psychologist, and we'll recommend one for you.
My gosh.
So I said, I do know what needs to be done, and I do want an EKG. So I stood up for myself, and they did it, and there was a blip on the EKG that showed, wow, you should have some follow-up. Follow-up testing, I did get a primary care physician, so I did the right thing.
Yes, you did.
Went, had that relationship started, and then we did follow up, and much, much better. But I think that women really do have to take it seriously. They have to take their empowerment as far as their health care is concerned, and speak up. There's no problem with speaking up and asking questions.
So, oh my gosh, that's an amazing story. I'm so glad you took action. Women take care of everyone and then themselves last. We've got to stop that. All right, we are going to take a break, but when we come back, let's talk about some of the symptoms women experience when they're having a heart attack. So stay tuned. Joining me this morning are Dr. Francisco Velázquez and Patty Sipes from PAML. And Doctor, when we think about the symptoms of heart attack, most of us envision the man, clutching his chest, but that's not what it's like, especially for women, right?
Well, that is correct. That is the typical picture we have of somebody like me holding onto their chest with severe chest pain. But we do know that between 20-25% of women will present without pain. Actually, they may have pain totally unrelated to the chest. It may be pain in the abdomen, it may be pain in the back, or even in their jaw, like Patty mentioned in her particular case, or no pain at all. And they may come in with confusion, sweating, with nausea and vomit. And sometimes they get this very cold sweat that is almost like a stress reaction. So the interesting thing is that women may take an aspirin thinking that maybe I have something, but then they won't go to a doctor. And the last thing you should do is don't go to your doctor. Patty mentioned that one of the concerns was, what if they think I'm just wasting their time? Don't think like that. You should go and get checked.
Absolutely.
Minutes count. The first 90 minutes are critical.
Well, what are some of the risk factors, and do they affect women and men equally?
So there are some that are more impactful in men than in women, or vice versa. But as a general rule, when you think about risk factors for heart disease, you have to think about cholesterol, particularly the bad cholesterol, the LDL, as opposed to the HDL. You have to think about diet and nutrition, obesity, diabetes, and also genetics. If you have a family history of heart disease, it is more likely that your risk will be higher.
Oh, that's so important to know and think about. And Patty, tell me more about the cardiovascular disease testing that your company offers.
Absolutely. At PAML, we are actually a national reference laboratory. So physicians can order the testing through PAML, and then we have our consumer site for consumers to go to so that they can monitor in between doctor visits, and that's called Cinch, and the website's gocinch.com. So there are two ways they could get testing. We try to make it pretty versatile. Most people look at the LDL and the HDL. The LDL is the bad cholesterol, the HDL is the good. They always say H for healthy. So it's a good way to remember the difference.
Good way to remember.
So with the LDL though, the studies have shown that the LDL is a number that everyone should know. So that's something that could be monitored regularly in between visits. Sometimes I look at it and say, okay, get this done, and then I could take it to the doctor when I go in for my physical and say, you're gonna do it anyway. I've done it, I've checked it. Here's what I've done proactively to keep my health going well. What else would you recommend? Am I doing the right thing? So there's many things that one can do to empower themselves with the testing. You can go further. There are many more tests for cardiovascular disease that are available today with very long, complicated names. Some actually help measure what you need to do for the HDL, and some do other measurements to say what you do with the LDL. They even measure the inflammation of your arteries to determine how likely you might be to have an event occur. So with all of this, you can go to your physician and get that done. They range, if you go online to gocinch.com, from $50 to $150. It really depends on what you want to look for. So if you would like the a la carte services per se, you could, the bill could add up a little bit, but it's still going to be much less than if you went the traditional route.
Oh, that's such great information that we all can take away and actually control our health and look at it and help our doctors. Thank you so much for joining us this morning. And Doctor, I understand you're coming back to talk about cancer screening, so important as well. Thank you both, and
Thank you.
We'll see you next time. And for more information about ordering cardiovascular and other diagnostic testing online, there is a link at thebalancingact.com.